Hi, and welcome back to Becca Babbles podcast. I'm your host, Becca. I'm a certified personal trainer, holistic health coach, and future chiropractor on my way to figuring out this thing we called life. Now, let's get babbling. Hi, everyone, and welcome back to Becca Babbles podcast. I have another special guest with me today. Well, I guess not another. He's almost the same guest that I had back a long time ago. Dom is back on the podcast.
Yeah.
Yep. He decided to come back when I invited him after being on the R2P Symposium recap podcast. I just had so much fun. I was like, hey, I want you back on here. So we snagged him again, but this time it's going to be talking about POTS. We're going to dive into what POTS is, how it can be so different, especially because it's become so common now with people, especially talking about MCAS and EDS, hypermobility, and all of that stuff surrounding that. And Dom actually did a presentation in our nutrition masters that we're currently taking, and he dived all into POTS, and he also has his own personal story going alongside of POTS. So I decided to snag him and be like, hey, we're doing a podcast together on it. So do you want to say anything about POTS before we dive into it, or about yourself?
Yeah. So, like she said, my name's Dominic Coe. Same trimester, Try-9, heading off to our community-based internship. So we're almost there. So super excited.
Whoop, whoop.
Yeah.
4 more months?
Yeah, 4 more months. So, like she said, we're both in the functional nutrition masters at Parker University. She's a little bit more farther along than I am. But one of the projects that we've all had was to make a nutrition notebook. So so for my project, I chose to do it on POTS syndrome.
And
yeah.
What does POTS break down as?
Yeah, so POTS, basically what it breaks down to is an acronym. It's called Postural Orthostatic Tachycardia Syndrome. And the reason it's called syndrome is because it makes up all sorts of different symptoms and can have so many different presentations. So that's what kind of makes it complicated. But to break down the word, basically all it means is that if you're changing position, so going from laying down, seated, standing, anything like that, there will be an increase in heart rate, hence where we get the orthostatic tachycardia. And the main criteria for this, what would give you the diagnosis of POTS, is simply having a heart rate increase of greater than or equal to 30 beats per minute in an adult. And that's a sustained increase in heart rate. Whereas in adolescents, so teenagers and younger, this could be 40 beats per minute, greater than or equal to. And this is within 10 minutes of standing without any change in blood pressure. So when we're talking about blood pressure, although there is orthostatic hypotension, so there can be a drop in blood pressure, that is another syndrome that is also very related to POTS and has a lot of the same symptomatology. So there's a lot that we can gather as applying it to those that have issues with blood pressure in this type of syndrome, and then those with heart rate. But for POTS, we're mainly talking about the heart rate change.
How would you know if it's like POTS versus like maybe let's say someone's deconditioned and they're just like standing up? Would they have the same dramatic change?
Yeah, most likely not. Like even in those scenarios, because we're talking about like very little change in posture. Like it would be, for instance, me coming from this seated position to standing and my heart rate jumping to 30 plus BPM just because I'm trying to make up for whatever my body is perceiving as dangerous.
Gotcha. Going into that, why does the heart rate spike so dramatically in people in POTS?
Yeah, so there's honestly a lot of speculations for that. One of the big ones that they have right now going around is the idea that there could be a pooling of blood in the legs when you stand up, so our blood vessels aren't really responding and constricting in the legs upon position change to a higher level. And so our heart, what it'll do, will try and make up for that change to try and increase blood flow to get it to the brain. So for some reason, there's not as much perfusion of like oxygen and blood to the brain. So that's one of like the main like theories behind it, and can be for a lot of people the reason. So they have found that to be the reason, but in a lot of other people, there's many other reasons. So I'm sure what we'll get into talk about later, because what I ended up discovering as I was researching for this research was that you had had an increase of POTS diagnosis post-COVID. So in 2020, all of a sudden they saw this massive increase in people being diagnosed with it at a later age, being fine for so many years, and then all of a sudden they're in their mid-30s, 40s, 50s, and they have POTS, and they don't know why. Also, with there could be some issues with people that may have like a vagal nerve issue, so the ability for their parasympathetics and sympathetics to regulate, so your fight or flight versus your rest and digest systems.
And is the vagal nerve, what is that part of?
So vagal nerve is, you're talking about like it being a nerve from the brain that kind of controls, like it controls digestion, it can control just nervous tone. It can be influenced by things like anxiety, stress, all these things. So vagus nerve is very, very powerful and can do a lot of things because really it innervates a lot of things from the heart. So the reason, so that is, thank you for taking me there, because that is another theory behind why POTS happens, is that there's an issue with the vagal nerve causing an issue in the signal to a node in the heart called the SA node. So the vagus nerve actually branches out and connects to that node, which is, they call it the pacemaker of the heart. And so what ends up happening is, for some reason, that nerve is inflamed, whatever it may be, there's something wrong there, that it's sending a signal to the heart that we need to pick up speed.
Well, because I know, so the vagus nerve is very strong in the like parasympathetic system, your like rest and digest. But I also know from like tutoring a lot of Phys 1 and Phys 2 students that like learning about the reflex.
Oh, yeah.
And how like the main nerves for that is the vagus nerve and the glossopharyngeal nerve, which those are both cranial nerves that come from your brain that regulate different types of parts of your body. But the baroreflex, that reflex helps when like you go from lying down to standing up, your blood will pull to your legs, but then the baroreflex goes off because it's sensing that change in pressure. The pressure is going down, and so that baroreflex goes off, sends a signal to that through that vagus nerve, like, hey, we need to like get this pressure back up. That's what allows the blood to go back to your head. So that makes sense that like if that vagal tone, which like what is vagal tone exactly?
Yeah, I mean, vagal tone is just kind of a term just to describe if the like quote unquote tone of that nerve is kind of in a hyper or hypo state. So is it over regulating? Is it under regulating?
Okay, that makes sense. So back to like the baroreflex, if it's not working well, then like it's not going to be able to have that response.
Right.
Making sense of why like they almost feel dizzy.
Yes.
Standing up.
Yeah. That's exactly right.
Yeah. Cool. Well, for someone who is questioning maybe like what does POTS look like on a day-to-day basis? I know it's very different for everyone, but what does it look like for someone with POTS?
Yeah. So, like I said earlier, one of the main things that people will experience with POTS will be an increase in heart rate. Sometimes you can feel that if anybody's ever had like tachycardia or ever had a need for beta blockers to help lower their heart rate. But oftentimes, like personally for me, because I've struggled with POTS myself growing up, you're going to feel like either in a position change or when you're overexerting yourself that you'll end up getting dizzy. And then a lot of these patients will end up having fainting spells because they're not getting enough perfusion in their brain. Like I said, like this is a syndrome, so there's a lot of things, but the main things are going to be related to the heart and related to the responses that happens. Like I said, dizziness, fainting spells, pre-syncope, things like that. But there are other things associated. So you can get things, so there's kind of a breakdown that they gave us in research. So the NIH, so one of our leading governmental research boards, they put together a group of researchers that are experts in this field, which I drew a lot of this data from. And they basically broke down the symptomatology that they see mostly in POTS patients in kind of different categories. So I'll go through those right now. So one of the first things that they'll go through is like heart and then also nerve. So for like nerve-like symptoms, you can get things like tremors, Shakiness of the hands is probably one of the easiest ways to see it. Anxiety, migraines, chest pain, heat or temperature intolerance. For heart, you can get things like sinus tachycardia, so that increase in heart rate. And there can also be other arrhythmias that they've noticed, both like pathological and both related to POTS. And then things like hypovolemia, like Rebecca just talked about, as far as maybe there being a pooling of the blood in the legs, or just an in decreased volume of water or blood. Can have decreased stroke volume of the heart, can have exercise intolerance, can have heart palpitations, and like I said, presyncope or syncope, so fainting spells. And then we also can have gut issues too. So like this all comes back to the vagus nerve, right? Nausea, vomiting, diarrhea, constipation, feeling full earlier, bloating, and then with immune, we can also get stuff. So Becca mentioned earlier MCAS, so Mast Cell Activation Syndrome, which is kind of a large syndrome to describe like increased histamine responses. And so what they'll see is like flushing, pinpoint red dots on the skin, trouble speaking, headaches, excessive like need to urinate, or food or environmental reactions. And then we can also get MSK. So another associated thing with POTS is hypermobile EDS, so Ehlers-Danlos syndrome. And so you can get things like joint pain, instability, hypermobility, clumsiness, having the decreased ability to kind of like feel with your feet, so proprioception, which I believe Becca has talked about in the past, frequent injuries, and then delayed recovery. So these are all things that they've noticed encompass the syndrome. Now, if you have one of these things, I mean, this is why it's important to like see a doctor, see your health specialist, to be able to determine, because a lot of these things, because you can have like a true arrhythmia or maybe a heart defect that mimics POTS, but it's not POTS because they found out that, oh, you have a issue with your heart valve or something like that, or it can be that you truly do have a histamine response or an autoimmune disease that are causing these symptoms that mimic POTS. So first things first is, does it increase your heart rate when standing, and are you feeling differences in just consciousness or dizziness when you're changing positions? Is the main things.
Well, and that makes sense why POTS can be misdiagnosed so easily, because there's so much going on. It's like represented in different ways. But then, like you mentioned, it's important to make sure, like, just because you have hypermobility, you shouldn't be freaking out like, oh, maybe I do have POTS because that one time I walked up the stairs, or like the one time I got up from watching Netflix for 2 hours, like my heart started to increase, maybe I have POTS. Like, we don't want to create fear here, but like, it's just an acknowledgement of like, hey, we need to do our due diligence of like making sure that you as the patient who is coming in and seeing someone like us, that like we see you as a whole person, but then also the patient coming in and being like, hey, this is what I heard, what do you think? And you as the patient have the right and authority to do that. So when making sure that someone, like, let's say they've got that like hypermobility, and then they're like, you're saying the test that they would do is to see from lying down to standing that increase of 30 beats.
Yeah, so just to kind of piggyback off of that, if you're having some of those other symptoms, it doesn't always mean POTS. Those are just things that they found that are associated. I was going over earlier just to review some of the stats that they went over, that the NIH went over. So like they're finding that about 40% of EDS patients have POTS-like symptoms, whereas 20 to 30% of POTS diagnosed people have hypermobility. So there is an association. And with that, like, that's going back to that idea that there's increased elasticity in the blood vessels causing pooling. But like with these, to actually be diagnosed with the syndrome, this isn't going to be like a one-off thing. Like, how many times are we like out playing a sport, or we get up way too fast and we're like, whoa, that was a little too fast. Like, those things happen. This is going to just be like I said, sustained 10 minutes. So how they actually diagnose it is they'll do what they call like as an orthostatic like heart rate test. And like I said, they're checking your heart rate from a flat laying face up to standing and looking at 10 minutes of seeing if your heart rate has a sustained 30 beats per minute heart rate if you're an adult, or 40 if you're young.
Well, and I think that's the big thing is the sustained heart rate.
Oh yeah.
Because like I even know there's been a few times where it's like I stand up and then like my heart rate's increased a lot, and whether that be due to stress or just like other like environmental things going on, but typically like within a minute or so it's gonna like go back down to its normal rate. But if it's that sustained heart rate, then that's where like we need to take a little bit more precaution to it.
Yeah, because then what they're finding is like basically what you're seeing as a clinician is like, okay, their body is not able to regulate change well, and why? Like we should be able to feel like if we did something too fast, like we may feel something because our body wasn't ready. It was early in the morning. We're not fully awake yet. We're not fully nourished. If those things are out of the way, these things unfortunately still happen in POTS patients because the body is not regulating well in those ways. Yeah.
So make sure you're hitting your big rocks first, and then if you're still having these abnormalities, then definitely go see someone for sure.
Yep.
I'm curious though, what, and you might have done research on this, I'm not sure, but like, what makes you think that someone with POTS would have something like EDS? Or like where is that connection?
Yeah. So that since they started doing research on this, and a lot of this research, like they've been doing this for years, but there's been a lot more since COVID because of the big increase of presentations of POTS. And so like they found one of the associations is EDS when they were researching populations of POTS individuals. And basically the reason is because if you're dealing with hypermobility, a lot of times we think of it as, at least in a chiropractic physical therapy world, we look at MSK, musculoskeletal issues. We're thinking joint hypermobility, muscle laxity, things like that.
Which joint laxity? What does that mean?
So just the joints may be moving more than we would expect them to. Would be like a simple definition. But also hypermobility can happen in our internal organs, veins, arteries, and that is the association. So not everyone that has been diagnosed with hypermobile EDS has vascular hypermobility, but many can. So that's where like those statistics come out, and they are pretty big. So it is, I think, for somebody that has hypermobility, that would be something to just be aware of. Yeah. And so we'll talk about maybe in a little bit about like some interventions and things like that. But it isn't always the case, but it definitely can be, and something to be aware of and be knowledgeable of if you are on that spectrum, for sure.
Well, now I'm curious. I almost want to go down every one. So like, let's say MCAS, like where is that relationship to POTS?
Yeah. So MCAS, really what we're getting is you can have an increase of mast cells. So this includes histamines, prostaglandins, leukotrienes. These are all so white blood cells and different things that help with allergies, parasites, like immune type stuff, right? And the things that they cause would be things like vasodilation, so dilation of blood vessels. They can cause increased heart rate. They can cause flushing. They can cause syncope-like episodes. So all these molecules.
Why would dilation of a blood vessel cause those kinds of things? What does that do to the blood flow?
So what that would do to the blood flow is like your body's going to have to respond when you have this chronic release of these histamines or prostaglandins. Your body's going to have to respond either, well, now it can't constrict, right, to keep the blood pressure at a regulatory rate. So the next step is for the heart rate to pump faster, because now you're going to get pooling in areas and have issues with now in posture, because your blood vessels are very dilated, they're more open, they're not going to respond as quick when you do stand. So that's where that theory and that kind of like but behind why POTS happens really relates well with like MCAS.
So you're basically having like these vasodilators, the things that increase the like diameter of the blood vessel, and it's constantly sending that signal. So then the vessels think like, oh, we need to stay big, which then makes it really hard for blood to flow through. Almost like if you were squeezing a tube of toothpaste, you want like to make sure that the like if you squeeze it hard enough, that's like your blood vessels constricting to get it to push through. But if like you basically have a empty tube that's like big but like barely any toothpaste in there, this analogy is kind of getting away from me, but like that would be the very dilated blood vessel, and it's hard to push it through.
Because we live on Earth, we deal with gravity, and so if our vessels have to respond in order to keep our brain full of nutrients to stay working, and if everything in our legs, which is a massive portion of our body, takes it all because gravity pushes it all down and our veins aren't working to stay smaller so it doesn't take as much, then you black out, you start feeling dizzy, which I've experienced in the past, and it is scary. But yes,
You're like, in short, yes. I'm curious because I've heard a little bit of this before. I'm not sure if you've heard of this, but I've heard there's a link between POTS and PCOS.
Yes.
And for me, I was thinking like, oh, it makes sense because I've also heard the connection with MCAS and PCOS. Or if there is GI issues. GI issues is really high with people with PCOS because PCOS is an insulin resistance issue, right? And so if we're dealing with insulin resistance can happen from a myriad of things, but usually it's that base of like our cells are basically not sensitive to insulin anymore, and so it's hard to regulate that blood sugar. But that can happen due to a myriad of things, due to your diet, due to high stress, due to like GI inflammation, which I feel like is a lot more common than people think it is. And they're having GI issues that are causing then their insulin resistant just because of that like constant inflammation. And so would you say that could be why there is that connection with POTS and PCOS?
I would think so. Like there's, as far as I know, in the research that I've done, I haven't delved into like the true association between those two, and I'm sure there is stuff like that out there now. But like what like the NIH consensus found out was that 15% of people have a comorbid diagnosis of an autoimmune disease. So many POTS patients, like I said, this is a syndrome, not a disease, right? You will find that you end up having things like PCOS, or some of the big ones they've noticed are Hashimoto's thyroiditis, celiac disease, rheumatoid arthritis, lupus. So like all these things, because when you think about it, when you have these other autoimmune diseases that may be taking or requiring you to have more nutrition or certain things, or not be able to absorb certain things, for POTS patient, maybe in that case, your body's struggling with kind of managing it towards electrolyte absorption, towards nutrients that are for heart and brain regulation and blood pressure regulation. So that's the hard thing with autoimmune diseases. It's kind of broad base, right? Not everyone who has one autoimmune disease all acts the same, because it might just be how their body is regulating and kind of managing where things go.
And that's almost where it's like it's so important to like get down to like the root cause of what you're dealing with rather than just looking for diagnoses, because diagnosis is like, as someone who's been diagnosed with PCOS, like yes, it was a bit relieving to like have a diagnosis, but then at the same time it's kind of like, where do I go from here? And then like, unless you actually go to a really good practitioner or you go on Dr. Google, or now it's like ChatGPT, like that can like give you some scary things of like what to do. But for me, I was listening to a podcast recently and they were talking something about relative to like the gut. But for me, I just like, it's opened my eyes. Like I knew the gut health was important.
Sure.
But it's like, it is so much more than you just needing your regular bowel movement, because like that like little saying that like people started saying where it's like you are what you absorb, not what you eat. Like there's so much truth to that, because if you aren't absorbing your micros, and you're not getting in that micronutrient and all those minerals and stuff, like those are the powerhouses and the like what help you like do all the processes that you need to do in your body. And if you don't have that, then like the body can't work as well.
Yeah.
And then add on top of that, if you're eating the standard American diet, then it's like not only are you lacking fiber, but then you're also lacking the nutrients that you need, and then there's even more inflammation on top of that. So like that's why lifestyle intervention is so important when you're dealing with stuff like this.
Especially this syndrome, yeah.
Yeah. You've kind of mentioned this a little bit, but I know that you've dealt with POTS, and so I'm kind of curious about like what your story looked like with dealing with POTS.
Yeah. So I wasn't diagnosed with POTS syndrome until I was 18 years old, even though I've been dealing with like a lot of the symptoms we've already talked about since I think probably first grade, maybe. And I was never diagnosed with it. So a lot of times, people who have POTS will be seen by their primary care physician and then be referred to a cardiologist to check for anything there, and then they'll manage it. And cardiologists normally are the ones to give the POTS diagnosis because they're the ones that will do like the active stand test and things like that. But when I was in kindergarten or first grade is when I had my first fainting spell. And what I noticed is that when I was playing around outside, super hot outside, and most likely was dehydrated, wasn't drinking enough water, and I started feeling faint and very kind of like lethargic. And then all of a sudden, next thing I know, I blacked out and I'm waking up to everyone around me being like, oh, what happened? And so that was kind of the first instance of like, oh boy, what's going on? Went to a cardiologist, um, didn't really find anything on ultrasound wrong with my heart, but I did end up failing a stress test. So there was clearly something wrong with just my body not being able to keep up with like the treadmill stress tests that they do. So about probably a couple times a year throughout elementary, this would happen to me. If I was dehydrated, I didn't always, like early on, it was related posturally. If I got up too fast, like I would black out. Like my parents told me a story that I vaguely remember, but just sitting down in a movie theater for an hour and a half and then got up, instantly blacked out. And then, like, thankfully, my dad caught me. So has been something that I've been dealing with, and that usually is the typical presentation of like POTS. Is like you'll be sitting down for a while, and then you try and get up, and you might not intentionally be like, "Oh, I got to get up and go." It's just you just get up, and then boom, it happens. However, as I got older and got into like my teenage years, I started growing out of that to where it wasn't postural related anymore, but I was only getting fainting spells when I was sick. So under any type of viral load. If I got up in the middle of the night to use the restroom, I would pass out. If I was sick and tried to just do too much, standing for too long, walking around, I'd feel faint. But thankfully, by this time, I started like recognizing the symptomatology and things like that, and would announce to people like, "Hey, I feel like I'm going to faint," and then I'd lay down. And then many times I was able to prevent an actual fainting episode, but it took a while to kind of re-regulate and be like, okay, I think I'm safe to get back up. However, kind of what took a turn in my life is when I was 18 years old. Like I probably was about like 3 years of not having any fainting episodes. So like it was getting better. I still had to be very careful when I was sick, but I was better at managing it now. But however, this time I was sick with a virus for about a week, and I'm not sure which one in particular. And I was getting better, and I remember this. It was on a Friday, and I was standing up for a while, and I felt fine. And then all of a sudden, I started feeling like I'm getting faint. I'm feeling weird. Like I just don't feel myself. Instant fatigue. And then I went to my dad, who's a retired firefighter from the city of Las Vegas, and my mom, who's a hygienist, who's trained in emergency care as well. And I was like, I'm in a faint. And they're like, what? So I got on the floor, and my dad said I didn't even make it fully to the floor. I just collapsed. And then when he rolled me over, I wasn't breathing, and I had no pulse. He couldn't find the pulse. And that's the first time that's ever happened with that type of a fainting spell. And my dad was doing sternal rubs, so one of the first stages of like CPR to see, because he couldn't find the pulse. My mom couldn't find it. And my dad's trained in these scenarios. And sure enough, thankfully, by the grace of God, I came to on my own before CPR was ever administered. And to me, when I woke up, it felt like a normal fainting episode. And my family was freaking out. My dad's like, dude, I couldn't find a pulse on you, and you weren't breathing. You were pale ashen gray. I was like, what? So 911 arrived. They had me get up. I was able to stand up and walk to my own gurney, got put into the ambulance. Yeah, super odd. No, this was in a rural town, so
That makes sense.
the emergency response may be a little different in some areas, but got put in the ambulance. They were going to start an IV on me, and they couldn't find it, so my vein. So I think at that time I was very dehydrated, and they ended up striking like a nerve tendon or something with the needle, and I just felt like an electric shock go from my arm all the way up to my brain. That it was like excruciating, and I announced to them as soon as it happened, I'm like, I'm in a faint. Sure enough, I did. And by this time, they had the EKG set up on me, and it recorded an 18-second heart stop, complete asystole, so flatline. No beating of the heart, no breathing, no nothing. And they stared at me the whole 18 seconds. They didn't do CPR. They didn't have an AED on me, which, for those who don't know, you can't shock an asystole. It has to be an irregular rhythm, so you can't do resuscitation that way. You really can only do chest compression and breathing. And they didn't do that. And thankfully, again, by the grace of God, my heart started beating again. I awoke again. But now we had this evidence that my heart did stop. And it wasn't until this incident, when I was in at the hospital for over a week, where the electrophysiologist doctor finally gave me the POTS diagnosis to help describe to other practitioners that I may see, or other people, that basically the symptoms that I deal with. So I'm not the, I guess, quote unquote, like paper POTS patient, because in those scenarios, it's not really postural anymore. But yeah, it was very scary. So now I have a pacemaker that makes sure that my heart doesn't stop. So can't go below 50 beats per minute, which is good. And thankfully, I haven't had an episode since. But it was weird, because after that scenario, I really struggled. That's when I felt like I had legitimate POTS, was in the hospital. I couldn't get off of the hospital bed without, because now that I was tracked, without both my blood pressure and heart rate dropping like crazy, and then my heart rate would like jump up like super fast. But yes, it was crazy, and I haven't dealt with anything like that since, which I'm very thankful for. But yeah, POTS can be definitely a very scary thing, but it's on a spectrum. Some people, it's very minor, and other people's, it can be very severe. And in my case, it got better as I grew up. But this incident was weird, so I have my speculations behind why that may have occurred the way it did. But like I do Brazilian Jiu-Jitsu, I do things that do different postural changes. So as far as I know, I just really struggle with it when I'm sick.
Yeah. That's a lot to
Yeah.
deal with. Yeah, that was a lot. Thinking back to like your 18-year-old self, what was it like waking up and seeing your dad's face?
Well, man, like I thought it was just a normal fainting episode, because I used to get mad if my mom called the ambulance, because I mean, they weren't going to do anything besides take me to the hospital, give me an IV, and send me home. But like this time, when my dad was like worried, because I mean, he's dealt with me with this before, I was like, oh no, I didn't know. But like we even had this whole thing like with the doctors, and thankfully I had an excellent electrophysiologist doctor who like believed our story, because every single one would be like, oh, I'm sure your dad was panicked and just couldn't find it, well, because it's his son, so he wasn't as proficient as if he was in an actual.
Yeah, your dad's like a firefighter.
Yeah, it's like my dad worked in one of the top 3 busiest stations in the whole entire country in downtown Las Vegas. Yeah, he's spooked because it was his own son, but he knows how to find a pulse and he knows how to tell if I was breathing. And then thankfully, for some reason, the EKG report wasn't given to the hospital when I was dropped off either. So we waited a week, and both my dad and the electrophysiologist was calling this particular fire department, asking them for the EKG report, which took them almost 7 days to get. Yeah, and sure enough, it was. So yeah, it's
what was
crazy.
it like leaving the hospital?
I mean, by that point, leaving the hospital, I had my pacemaker, so I knew there would be some changes. But I mean, I was assured by my electrophysiologist doc that with the pacemaker, not much of my life would need to be changed, which I'm thankful for. Obviously, I have to be careful in some things, but as far as that, I mean, I can still do jujitsu. I can still run. I can still work out. I can still do chiropractic, and this all happened to me prior to getting married, prior to having kids, prior to starting chiro school. And I just made it kind of my mission that I already had these things planned and I'm going to go for it and I'm going to do it. And God preserved my life and I hope to honor him in those ways to just continue coming on and doing what he's given me. And man, now that we're like 4 months from graduation, it's crazy.
Yeah.
But yes.
Is there anything you're still worried about?
Yeah, I mean, I get worried occasionally just with having a pacemaker because there's always a risk of the actual lead, which goes through my subclavian vein into my heart. It can potentially get dislodged, which I mean they can repair. But I've also seen things because like we had the privilege of being in Gross Lab and dissecting our own cadavers, and I had one cadaver in particular that had a pacemaker. And I don't know when that pacemaker was given. I mean, my doc was like, was worried because he's like, we don't get 18-year-olds with this issue or give pacemakers to 18-year-olds.
Yeah.
Normally that's like, and he did a lot of research. He probably researched for about a total of like 3 to 4 days. Like, I could have maybe left the hospital earlier if it wasn't for him being like, I'm not ready to give you one yet because I want to see if I'm giving you the best one, if you actually need it, if it's a 1 lead, a 2 lead. But yeah, it worries me a little bit because when I saw that cadaver, their whole entire chest was like basically black left side with like muscle atrophy. The veins were weird. It was just very strange. And I've heard things where there can be things like kind of where there'll be like scarring inside the vein to help kind of attach the cord and things. So there are things that kind of do concern me, but I've had it for uh 3 3 3 years, 4 years, and I've been fine, thankfully.
Yeah.
And every time I get checked up on, they're like, your pacemaker barely has to ever work. It's just kind of there just in case. So, which is awesome. So we'll see.
Great.
The biggest things is just, I mean, stay moving, stay mobile, and stay healthy, right?
Yeah.
But yeah.
Would you say that kind of really made you passionate? Because I know nutrition obviously is something you're really passionate about. Would you say that kind of like set your purpose on fire for looking more into nutrition and movement and stuff like that?
Gosh, yes. I would say it helped me a lot to just dive into nutrition, and I guess my interest, and we talked about it a little bit. Like, I kind of differ from Rebecca a little bit because she has this passion for like diving into like labs and all this stuff and kind of getting to the root cause and figuring out why and helping people with a better lifestyle. And my research and my passion for nutrition has kind of more gone along the lines of like figuring out like systemic chronic diseases, why they happen and what to do about them. So it's a little bit like specific in an area because I mean the stuff that you do, it's a lot. It's going to be a lot. And me, I kind of like finding the things of like, man, could this stuff like really work and help people that have this particular condition? So
this is why I have so many Notion templates that you make fun of.
yeah, you and your organization, which is good, which is very good. But yeah, because during this, and I'm sure we'll talk about it maybe now or in a minute, but COVID, so that it really boosted my interest in like COVID, why that happens and what to do about it. And honestly, as far as why my particular situation, I think went the way it did, because I think I probably did have COVID during that week, most likely. I don't even know if think they did a COVID test on me, but like they
was
did.
Was it during the pandemic?
This was 2022.
So towards the end of it.
Yeah, towards the end of it. And I've had COVID before, prior to that. But like when I was doing the research, that the NIH form basically said that they've never seen so much of an increase in POTS like symptoms until COVID, until the pandemic. And that's just kind of crazy. And then another doc that I really look up to, he's a cardiologist, one of the leading researchers in cardiac research, who is, I think, still located in Dallas. His name's Dr. Peter McCullough. He and his team did research on COVID and long COVID, and what they also determined too in their paper is that a lot of the symptoms that happen due to long COVID mimic POTS syndrome. And those are some of the main symptoms that they see in long COVID.
Well, yeah, because that's where I would question. I'm like, is it really we have more people with POTS, or is it just we're getting better at diagnosing POTS?
I honestly think in this scenario, because I mean, that is a good distinction. As the medical field and science grows, we're able to find more things. As things expand, we're able to find more things. But I think in this scenario, it is that there is more POTS. Because obviously I think there's an area where it's like they've noticed maybe a relationship between something, and then they're like, oh, let's study it. It's like, oh wow, it's there, and it may have been there for a while. But with with COVID, we've never seen something as crazy as the spike proteins that are found in both the virus itself and the vaccines that are administered. And so like one of the mechanisms that they are proposing and have shown in some cases is that, or they have proven that the spike protein binds to two certain types of cell receptors in our body. They bind to ACE2, which I don't know if you want to get into like the physiology behind that. But
why not?
I'll let you do that since you're the phys tutor. But that's one of them, ACE2, which is in the angiotensin system, managing fluid volume, electrolyte balance, all this stuff. And then the other one, which maybe I can get into myself, because I don't know if you've done research or if they're teaching that in phys much, is nicotinic acetylcholine receptors.
Yes, we've talked about this.
Yeah, is the other one. And they both, the spike protein from both the virus and the vaccines bind to these and cause a dysregulation of both these things. So with the nicotinic acetylcholine receptors, which are pretty much found in every single cell in the human body, regulate a lot of things. That's why they're proposing why maybe there was an increase in like diabetic rate in COVID populations, because there was a binding to these receptors which help regulate the beta cells in the pancreas, which secrete insulin, which help prevent diabetes and cause uptake of glucose and stuff, so your body regulates blood sugar. But these receptors are also found on the vagus nerve, on all these nerves that regulate these things. And so now what they're finding is that you're getting nerve inflammation, autonomic activation, and then other like neurotoxic effects, because the spike protein basically binds to these nerve cells and causes chaos.
So you're basically saying that, let's say someone had COVID, whether or not they got the vaccine or not, that these spike proteins bind to these receptors that regulate things like blood pressure, regulate things like absorption in the gut, regulate things like parasympathetic state.
Yeah.
And it basically, when something that isn't supposed to bind to a receptor, it typically has effects that we don't want. So like for instance, there can be different molecules within our bodies that bind to the same receptor, but then have different effects. Or I'm trying to think of an example. I think there's one with like the estrogen receptors, where it's like then you tend to have like problems with like ovulation, but it's not coming to my mind right now. Anyways, so you're saying like, okay, these spike proteins bind to these receptors where they're not supposed to, and basically like kick on or change the state of that, whether that be the nerve, whether that be the like cell itself, or just the state of the digestive system. Is that correct?
Yeah. I mean, like a lot of the factors they found is like it can cause inflammatory issues, immune issues, gut dysbiosis, all these things. I mean, that's the spike protein. I mean, pretty much goes everywhere, and because it particularly attaches, it's not. In a lot of studies, they've found that it's not like a the main binder. Like for those that have like gotten past physiology and stuff, like there's also like the like ligand receptors that kind of change how that cell reacts. They actually bind to that accompanying site instead of the actual binding cell and change how these receptors communicate and what they do. And depending on the concentration, it can go one way versus another, which is kind of interesting. So like there's still a lot of speculation in that area, but as far as like changing it, but as far as the spike protein, yeah, it can cause damage in so many areas, and that's why like we're seeing things like long COVID of people 2 to 3 years after the actual true viral infection are now all dealing with food intolerances or high histamine levels like MCAS, or gut issues and POTS like symptoms and things like that, because it attacks your nervous system.
Yeah. How, like, because I know with like hormones, obviously, like they bind onto the receptor, they stay there pretty long, but then after a while, they start to like, they leave the receptor and kind of where you're supposed to detox them and all that stuff, and they're going to break down. And then we end up either peeing them out or we poop them out. It's kind of like how the body works. With the spike proteins, does it just like stay on there forever, or like how does that work?
I'm not sure on the exact answer there, but basically because they bind to these certain cells and they can cause such a massive a systemic effect, your immune system's not able to destroy them.
Gotcha.
And get them out without like time. And this is the thing that, I mean, kind of is sad too, is because a lot of the same effects can be found with those who have been vaccinated too, causing this nerve inflammation and activation of the autoimmune system. But yeah.
Yeah, no, that's really frustrating because I know we have a friend currently who like she didn't have POTS growing up.
Yep.
And then she ended up developing POTS later on, in like her 40s. So like,
yeah,
which is kind of crazy because what is the typical age that like POTS is typically found in?
So I mean, prior to COVID, like it still unfortunately predominantly was found in women in like a 4-to-1 ratio, and but now like the broader category is now 12 to 50 years old is when they find it. And those older years weren't necessarily found until literally 2020.
Yeah.
When the pandemic happened. Because like they notice, at least I think why they notice like POTS syndrome in general with women is they associate it with like menarche pregnancy and things like that. And that doesn't mean that it can be a permanent thing in those times. It could just be during those like during menstruation only, or during menarche, or like things like that.
Okay, so when people have their period, and
yeah,
towards
because
pregnancy,
yeah,
because those are major changes in someone's
yes,
life. Yeah,
which change hypovolemia and the volume of your blood too, right? And then also during surgery, that can happen depending on where that surgery is, right? But yeah, now they're finding it in the older age group of people since COVID.
I wonder if, because also like that transition to menopause is another transition.
Yes, that's
of
another
like
one.
that's okay, because I was like, that's another huge transition of like hormones.
Yeah.
That happens in females. Poor females.
I know. It's sad.
Yeah. Hey, we gotta deal with a lot.
Between hormones and viruses and everything. Yeah.
You need to be a lot nicer to me.
Oh.
Like,
I will.
but more on a serious note, and I don't know if you have the answer to this or not. Do you think working with someone who has POTS due to like because they were diagnosed as a child and not due to COVID versus like POT like symptoms due to COVID, would you treat them differently?
Yeah, yeah. I think so. Like the first thing is, and I think this will be good to go into, is when you have POTS, and just kind of in my research, I think the best thing you can do is first, like, you see your PCP. They may do like the certain tests for POTS. If they're worried about increased heart rate, they'll refer you to a cardiologist, where the cardiologist will do scans, ultrasound, things like that. Because first thing with POTS is if you have any of symptoms that are in that syndrome, you want to rule out red flags. Do you have a hole in the heart? Do you have valvular problems? Do you have these different issues? And if you do have those issues, then those need to be managed those ways.
Mm-hmm.
It's not POTS anymore. It's you have a hole in the heart, you have a birth defect, you have these things, right, or other things that are going to cause hypovolemia, fainting, whatever it is, right? But after that, let's say you are like the typical POTS patient. You are a POTS patient. Your heart's okay. Things are okay. I really think at this point, you still have to be getting checked by your cardiologist to make sure things are progressing well, especially during like growing years if you're young, to make sure the heart's developing fine. But I think at this stage, to see a functional health specialist of some kind, if you find a good chiropractor that that is aware of your movement and things like that, and maybe even does functional medicine or nutrition on the side, that would be great. Or maybe they just do the movement portion. Now you got that area taken care of, because that's really important. Is kind of what we like to call graded exposure. A lot of times in POTS people, they do have exercise intolerance, and the best way to do that is to increase your capacity. So even though you may have this issue, it doesn't mean that you cannot move. It just means that you do have to work harder to increase your capacity. So if a normal person's heart works at this capacity, and you're starting at a different level because the POTS like stuff, or maybe now there's the anxiety and the fear that symptoms might happen that you're hoping to avoid, you just need somebody to be able to watch you and to help you move and increase like your cardio and things like that, increase your strength so that your body is able to handle it better. So these things can be managed to where the symptomatology dies down a lot, because you're just increasing your capacity to handle load and stress and things like that. But on the other end, I think it's also important to see, depending on if you're getting gastrointestinal issues, immune, things like that, to see an actual like functional medicine practitioner who can maybe look at lab, see, because maybe a lot of times it's just you need to increase your electrolytes. You need more magnesium, you need more sodium and potassium, you, or maybe you just need more vitamin D because your immune system is already working at a deficit because of whatever the causal factor of POTS is. We just need things to help boost these things. And so to go to someone who can figure that out, work with you, give you certain things to go off of, would be ideal. And if that's a cardiologist, that's amazing. But oftentimes they're just going to be worried about, do you need surgery? Do you need a pacemaker? Do you need something like that, a defibrillator, to make sure you don't die if you are a red flag case? But like I said, that's not POTS anymore. That's something else.
I would also be curious if, like, because you had mentioned the whole, like, is it a gut thing? Like, maybe you just need more electrolytes. But then going back to, like, if they're not absorbing it, then it's like, okay, maybe we need to do a GI map first.
Sure.
See, like, okay, do we actually just need to, like, get your gut function better so then you're absorbing better? And maybe you actually don't need more of a supplement. We actually just need to, like, fix the issue.
Exactly.
Like, it's a chicken and egg sort of situation, but like that's the kind of like thought process I feel like people should be having when they're dealing with a patient like this.
Yeah, and that's where like your naturopathic doctors, your functional medicine specialists, nutritionists like come into that equation very well.
Yeah.
Yeah, because a lot of times it could just be that your body's not able to absorb well. So even if you do supplement, that supplement might not really help because your body's still not absorbing it.
Yeah.
But yeah, and like I said, a lot of POTS patients deal with the gastrointestinal side. So then the question is POTS caused because there's a lack of absorption? It could be.
Yeah.
And so that is the thing. Again, like we said, this is a syndrome. And a lot of the symptomatology could be an indicator of where the problem or cause is, or it could just be it's related and that there's something else. So that's why it's hard. But the best thing I would recommend for like anybody listening that is maybe in chiro school that's going to be seeing patients like this, or somebody who has these things, to like obviously control your care. You control your own health, right? And you control what you give to practitioners, but trying to keep that into a group, because oftentimes with these syndromes and things, it can be over tested to where now you're just adding on heaps and heaps of anxiety because this doctor said this doctor said that. Like, first things first, like, you're going to have your PCP who's going to give you yearly checkups, and you're going to have a cardiologist. The next thing is maybe just finding somebody who does the rest of it well, or trying to mix it up. You find a chiropractor that's going to get you moving well, a PT that's going to get you moving well, keep your joints mobile, keep everything going, and maybe that has a great effect on the nervous system and things like that, and all the other things that could be good for it. And then you have somebody working on nutrition.
Yeah. No, I was listening to a podcast and they kind of talked about, it was kind of like the body's way of like what is the whole like mental hierarchy of needs or whatever. I'm blanking on the name, but anyways, he was basically saying the way that the body works is it focus first on survival, then it can heal, and then it can like adapt, and then it can optimize. You can't go, I want to optimize, even though my body is in a state of survival. And it's kind of that same thing that you're talking about. Like, let's make sure we're not dealing with a very critical issue of like a heart defect. And then, okay, now let's start supporting your body so then it can start to heal. And then from there, we can optimize. You don't have to like throw the kitchen sink at everything just because you got this one diagnosis. It's like, take it in time, take it in process, and like you don't, like, you're not a bad person, you're not doing bad things to your body if you're not solely focusing on this, because your diagnosis should not be your life.
Yeah.
Speaking of nutrition, what are some things like nutrition wise that can really impact and support POTS symptoms?
I think first, before we get into food, this is just something as any practitioner, just as an individual dealing with it, like, you have to consider medications, because a lot of medications can cause POTS syndromes. For instance, like certain stimulants, diuretics, any like epinephrine, like inhibitors, heart rate blockers or razors, and things like that. So sometimes those can cause it, and maybe that's for another issue that you're dealing with, and then that's causing these things. So that's like first. Second is, and this is I think super important, they recommend about 2 to 3 liters of water per day for people that deal with this, just to make sure that they have enough volume and that they're hydrating well. Because now that you have this, if you're dehydrated, that's going to feel a lot worse and potentially end up in a fainting spell than somebody else who's just like, I need to sit back, I need to just chill for a minute. No, this is like, yeah, you need to do something. You need to drink water. So just don't get there, and stay hydrated and balance it throughout the day. Yeah. And then another thing is they recommend having salts. So kind of what I like to do is I always like to have like an emergency thing just in case if I end up getting symptoms. So one of the brands that I've always used is called Bioplasma, which is cell salts, and that just dissolve under your tongue, which can be like helpful if you're like dealing with colds, fevers, things like that too. But when you have any symptomatology with POTS, like, that's a good one to like have in those scenarios. But then just throughout the day, making sure that you have a good source of like sea salt that you're putting on your foods to season with. Like, I was told my cardiologist. Like normally I tell my patients to avoid salt, which I mean in the functional world we can argue about that in certain cases, but he's like, for you, don't worry about it, just put it on everything, it will help you a ton. And it does help me a ton. So then just having like electrolytes, if you're drinking an electrolyte drink during the in the morning and you find that very helpful, which like in our friend that she mentioned earlier, that's what she does and notices a big difference and helps her a lot, is just one electrolyte drink in the morning kind of gets her started, which a lot of people, that's where they struggle with their symptoms the most, is in the morning. And then maybe just throughout the day, just making sure you're maintaining salt. If you're working out, if you're being highly active, that you're replenishing what you're losing through your sweat.
Or if you live in a humid state like Texas.
Yeah. If you're outside a lot, being careful of that. But yeah, nutritionally, I think I think at the end of the day is just making sure that you're feeding yourself well. Are you getting enough good real foods? And I think especially for POTS patients, it's important that you're getting whole foods, stuff that's going to be more easily broken down and is more readily available, which will be less load on the gut. And a lot of times, like what they found with POTS patients is that they'll even get symptoms following a meal.
Oh, wow.
Because for those who may not know, like when we eat, like that old adage that says don't swim and like right after eating, because that could be bad. Like wait an hour or two before swimming if you're eating. So in those contexts, basically, what kind of where that kind of stems from is that you do get a pooling of blood in your digestive system when you're eating and when you're trying to digest. So, but in a normal person that may be fine, but in someone with POTS that might mean that there's less blood being perfused to the brain. So now when you do little things that may not always affect you, now they do because you just ate. So people will end up feeling dizzy and fatigued right after eating. So what they recommend is actually maybe spacing out meals throughout the day. Maybe instead of 3 big meals, maybe it's 5 moderate meals.
I could also imagine the speed at which someone eats the meal could impact that too.
And not eating super fast as well. So and enjoying your food, taking your time, a good way to practice mindful eating habits, right? You're kind of have an excuse to do it now because you kind of have to hopefully avoid symptoms. But yeah, I think personally for me, like I've noticed a huge change when I've increased protein content. So what I've found in like the data is like anywhere from like 0.7 to 1 gram of protein per pound of like ideal body weight has been like super helpful just for just helping with muscle tone, things like that, and increasing like also helps with weight management, things like that as well. But all sorts of things that protein does in supporting blood, and because you need albumin, which helps with blood transfer and all these things, which they have found is low in POTS patients and many of them. So protein's very important. And then just making sure that you're getting good nutrients like iron, zinc, vitamin B12, all your vitamins really, in good amounts. So like I'm a proponent for grass-fed real meat, so eating beef, fish, things that have these nutrients in them naturally, that naturally have a lot of like minerals in them as well. Something when I was doing the research, there's not too much on like actual nutritional interventions for POTS, but I found this very interesting, like bone-in cuts for meat. So like any sort of cuts that have the bone in, they have more like collagen and mineral stuff in there, which is good. And also another one I found super interesting is take advantage of broth stews and stews and things like that, because it's so easily absorbable and in such a good and warm way that it kind of helps relax things. There's some people that will say that it can help with like vagal stimulation and things because you're consuming something warm that's liquid, super high in electrolytes and and collagen and all these things that are just great for your body, magnesium, sodium, potassium. So soups, stews, all those things are great. And are very easy to digest at that point too.
Well, and you also got that hydration thing, and that was the thing
Yeah,
where,
it
like,
hydrates you too. Yeah.
the eating whole foods, like, when you eat, like, a standard American diet, like, those kinds of foods, like, I'm thinking, like, McDonald's and, like, I can't even think of, like, Taco Bell, stuff like that,
Fast
where it's
food.
like, those foods are very low in water. And, like, most people think, like, oh, watermelon, like, that's the only one that has, like, a ton of water in it. It's like, no, it's like other whole foods, like, they actually have a lot of water content in it themselves. So you get, like, that's why people say that, like, you can, like, survive without food, but you can't survive without water, because you can survive without that nutrients for a little bit, but then you still, if you don't have, like, a ton of water, like, you can still get some of that water from the food itself. But that makes so much sense why that's even more important for a patient that is, like, dealing with POTS and needing that fluid content, because, like, I don't know if I drink 2 to 3 liters of water a day. I probably used to. I don't know if I do anymore. But it's like that to someone may seem like a chore, but it's like, okay, if you prioritize that whole foods, that's probably at least going to take away half a liter that you would need.
That would definitely help a lot. Yeah. And really just avoiding heavy things that take time for your digestive system to break down and absorb. If you're more on, like, the more sensitive scale of the POTS. Yeah.
And I could imagine that, like, okay, that might seem like, oh, shoot, like, now I can only eat these certain things and I can't. And it's like, no, that's not necessarily true. It's like, okay, work with a practitioner and, like, this is your starting point. And then as we get the body to, like, kind of calm down and slowly start to adapt, then you can start slowly adding things in.
Definitely. And yeah, with that too, like, the thing that you'd have to be careful of is if you are on, like, the MCAS spectrum where you have a histamine response, just for the meantime, avoiding things that cause that allergic reaction, right? And then eating everything else that's within that. And I mean, this by no means is a restrictive diet at all. Like, you can eat berries, vegetables, and things. It's just, as other notes, it may be, you may tend to better tolerate, like, things like root veggies because they can be more easily tolerated than raw greens, which I've found.
Give me my sweet potatoes. Let's go.
Yeah. Sweet potatoes, carrots, beets, parsnips, all those things. Squashes are great. Maybe you do cooked leafy greens, things like that. And then, like, a lot of these vegetables too, like zucchini and cucumbers, are just, like, so, like, jam packed full of, like, electrolytes that just kind of give you what you need to. So if you're snacking throughout the day on these things, these are just great ways to replenish it. Yeah, naturally.
Yeah.
But obviously having a good, like, electrolyte mix might be good as well.
Yeah.
But yeah, these are all great things, because at the end of the day, if you just stick to whole foods, these are things God has already created, and they're good. And some things we may react to because of how our bodies are if we have autoimmune, but we're not dealing with the hyper process. We're not dealing with all the other chemicals that could be in it. We're not dealing with, like, even though a lot of fast food can be still high in salt, you're not getting good, true salt that has all the other minerals, because true salt at the end of the day shouldn't just be sodium chloride. It should be all the other things. There should be magnesium in there and a bunch of different, like, other micronutrients, molybdenum, like, all those different types of stuff.
And I could imagine, like, someone who, like, starts doing this and, like, maybe they come from more of a standard American diet that, like, okay, you do this is, like, your diet for, like 90 to, like, 85% of the time. The, like, one off where you go on, like, a trip or something like that. Like, you're at least aware of what's going on, and, like, it's not, you'll know your triggers, you'll know the foods that you really react to, but you also know how to regulate your body. And it's all just, like, getting to know your body more, getting to know how it reacts to things right now as you continue to build it and make it stronger.
Yeah.
Speaking of getting stronger, do you like that segue?
Yeah,
I felt like that was really good.
That was good.
How can exercise help people with POTS?
Yeah.
Because most of the time I feel like people just think, like, oh, everyone with POTS feels terrible with exercise.
Yeah, so like I said earlier, that kind of graded exposure, building your capacity.
What does that look like? What does that mean?
Yeah, what does that mean? So, I mean, honestly, just to use, like, a basic workout analogy, if you're not able to lift a certain amount of weight and you want to be able to, you start lifting weights that aren't that, or lesser weights, to build up strength and endurance and the ability. And you grow muscle, you grow strength, and then you're able to lift that weight. But now in this sense, it's just for your ability for your heart and blood vessels to manage the exertion that you want to be at. And some people it may be very, very hard for, and other people it might be easier, more manageable. So you as a POTS patient, it might not look like you're going to the gym and doing powerlifting and bodybuilding and all the big stuff and doing a 2-3 hour workout. It can look as simple as a 15-20 minute workout regimen where you're getting moving, you're getting the heart rate up a little bit safely. And at first you're not doing things that require quick directional changes or any quick postural changes. We worked into that. That's why I recommend, I think, especially with these patients, if you don't already have experience in the gym, to work with somebody who is experienced, whether that be a personal trainer, chiropractor, rehab specialist, PT, whoever that may be, who is aware of your symptoms. Whether or not they know all the pathophysiology or everything about POTS, they don't necessarily need to. It can just be as simple as you telling them what to be aware of, what to look for, because I mean these individuals they'll know if you're looking off because that's what they do for a living, even if they're not a doctor per se, and so that they can help slow you down, stop you, and they'll hopefully coach you through things that hopefully work you up to it. And there is potential for these patients to be able to do everything everyone else can. It may take longer.
Yeah, I think that's the big thing is that, like, you are competing with, I don't like saying competing, but, like, you are working with your own body. You can't be comparing your body to, like, your best friend who's about to do a high rocks competition.
Yeah.
Like, don't go from I was sitting on the couch maybe doing yoga on and off to now I am getting into the gym and now doing high rocks because that's super popular. Like, of course you're going to have symptoms. Of course that's going to feel worse. Like, don't, you doing body weight exercises right now does not mean you're weak, does not mean you're a failure or anything. Like, you are doing what's best for your body, and you could eventually may then build up to where you can do a high rocks. I don't know, but it's going to take some time, and just have that understanding of, like, your fitness is going to look different than someone else's fitness, but that's everyone when it comes to fitness. And fitness isn't just the, like, thing that you see on Instagram where, like, everyone has the, like, the big muscular bodies or whatever. It's like, it's supposed to be you feeling good and feeling stronger within yourself and improving your health. And if you feel like you're going to pass out every time after you're done exercising, then it's like, okay, that fitness or exercise that you're calling fitness is not improving your health, and that's not health. I'd also say, like, the people who are also dealing with the EDS and the POTS, like, that's where strength training is really important. But strength training can look like just doing body weight exercises, because strength is
training.
Strength is relative. And, like, as long as you are progressively overloading and adding on either, like, a longer tempo or changing up the tempo, you are adding more weight or more tension, because the body doesn't know that you went from 10-pound dumbbells to 15-pound dumbbells. As long as you're changing it in some way and the body has to adapt, you will be making a stronger body.
Yeah. And the body can adapt in these places. And I think they talk about more, in which I want to do more research on as well. And I was on a recent podcast with Dr. Troy Briscoe, who does the Kingdom Strength podcast, and he went into it because I did a podcast with him on POTS as well. And then he talked about, because he started doing some self-studying on, like, POTS and, like, exercise. So if people are interested in that, I think that would be a great one to listen to. It'll be a lot of repetitive stuff too. We focus more on nutrition in this one than the other one, for sure, which is good. But I think we talk about a lot of, like, zone 2 cardio and things being very helpful for just increasing heart rate, stroke volume, things like that, to just get these things up, because those things can change. It's like working out a muscle, but instead you're working out your heart.
Which is a muscle.
Yeah, which is a muscle. You're working out your cardiovascular system to be able to handle and respond. And I love your analogy earlier. It's like you get to a point where you can adapt and optimize eventually, and you can adapt and optimize these things. But yeah.
I'm curious because I know you're super interested in DNS, dynamic neuromuscular stabilization. We've talked about this on the podcast a little bit. And for the people who haven't, you can give a little like debrief on what that is. But I'm curious if you have used that for yourself and if you've seen if that's changed anything with you related to thoughts.
Gosh, honestly, something I would love to do is sit down with either like Dr. Brett Winchester or any of the DNS practitioner instructors just to see if they've seen it with any POTS individuals. I have talked to docs about different things, and I've never talked specifically about DNS, unfortunately, but I have talked to Dr. Michael Shacklock about like neurodynamics, and he's seen people work on things that have been related to uh, the stellate ganglion, which is at the base of the neck at like it's at the front of the body of like C7T1. And so like he's seen things, not him personally, but of people doing the different like neurodynamic stuff and causing some change that was working on people that have some sort of vagal issue or uh, even AFib and things like that, which is super interesting. I've talked to Dr. Michael Leahy, and he's doing like manual therapy on those areas and things and seeing changes. And then I have talked to Dr. Winchester, and he has mentioned that there are like acupuncture points that can help with this type of stuff and management of symptoms. So it is interesting because the body is complex and there's things out there. Now, these aren't fully like researched. Some might not even be researched at all. And I know like these individuals are wanting to do some stuff as far as in that realm, because right now, like a lot of those areas are strictly like in rehab and movement and things like that. And acupuncture, though, has had a lot of stuff where they found things that help regulate the heart, blood pressure, things like that. And when I talked to Winchester about like my personal stuff, he did say that he has seen people where there has been changes with acupuncture, and he recommended that I might try it out. And
did you ever?
No, I've never tried acupuncture still. I would be interested, definitely. Yeah. And then I've also just seen, like, in my own experience, change from just being simply adjusted. Like, I had the theory get thrown at me that maybe it was just why everything happened was that I had the nerve inflammation, that I was sick under viral load. I already had like the prerequisites for POTS and those things, but maybe the reason why my heart stopped there maybe could have been like a nerve impingement or something, or just some sort of blockage or whatever. I know like we talked in MPI of like changing range of motion and things like that, but maybe there was something that, because I did feel a change when I finally did get my CT adjusted, and it felt different, and and so I've had those scenarios where it's like, man, there is something to be said where there can be changes on the nerves when the body is adjusted. So there's a lot there. As far as DNS, I know it can work amazing stuff with people who are on the hypermobile spectrum, creating more stability, creating more joint awareness, creating more joint centration, creating equal muscle pull, like all the main tenets of DNS. And I would imagine that there probably is some way where that can work with the body, but because DNS can do stuff with like the neurological area, but I'd be curious to like see more on like the neuro side, things they do maybe as far as like eye training or eye movements, saccades, things like that, or maybe any like postural stuff with like neuro things. I'm sure there's stuff that's out there, and I'm sure DNS can just be very helpful because it does help with tone. So yeah, that's definitely something I'm definitely interested in diving into, because there's a lot of speculations out there, which is interesting.
Yeah, no, there's so much to dive into, and thankfully, like, we are just getting started with our journey, so, like, and I feel like we have a pretty good head on our shoulders now, but, that's why, like, I feel like our field is so cool, because it gives us that opportunity to go down so many rabbit holes, and there's always so much more to continue learning, especially with, like, the almost information overload, but if you can filter that, then, like, you can learn so much.
Oh, yeah, definitely. And just being open-minded, too. Yeah, definitely.
Well, before we wrap this up, I wanted to ask you, because I wasn't really able to ask you this because we kind of like hopped over it, from your story, thinking back to that 18-year-old boy that just like passed out, saw his dad, had to go into that ambulance, then go into a hospital, what would you tell him?
Gosh, that's a good one. Man, I think I would have said, I mean, I feel like I was extremely blessed because there was an incomprehensible like peace that was in my heart during that time, and I'm very thankful because the Lord was very present, and my parents were present, and there was a lot of prayer and just resting during that time. But I think during the times where like I did get, because there was times where I was like rethinking everything. I was like, man, what am I going to do with my life? And I'm very thankful those were few and far between during that week. But I think in those instances, I probably would have just said rest. God's got you. He revived you. And don't take things for granted. Don't take life for granted. Don't take the people around you for granted, because we're only given this one life, and I'm very thankful that the Lord preserved me, and that He provided me the community of my family around me to encourage and to help me through that time. So yeah, to not take things for granted. Life is short, but I'm thankful that God has provided a way through His Son Christ Jesus to give us everlasting life if we believe and trust in Him. So yeah, I just don't take people for granted.
Yeah,
because their lives are short too. So yeah.
Well said. Well said, young Jedi. All right. Well, Dom, thank you for being on the podcast again.
Yeah. Thank you so much
this
for
is
having me.
Second of many more.
I hope so.
Thank you so much for listening to this episode of Becca Babbles podcast. If you enjoyed this episode, the best thing that you can do is leave a 5-star rating and review on Apple Podcast, Spotify, or any other listening platform of your choosing. If you want to learn more about me, you can do that by following me on Instagram at Becca Ann Wellness, or by checking out my blog, freebies, offers, and newsletter on my website at beccaannwellness.com. If you want to share the love of the podcast, you can do that by taking a screenshot and sharing it on social media and tagging me and the podcast at Becca Ann Wellness and using the hashtag Becca Babbles Podcast. I hope you have a great rest of your day, and I can't wait to babble with you next time.